Good evening, everyone. Let's begin our today's revision. As I promised, we'll be revising shoulder joint today for Mrcs Part A. And remember one thing, shoulder joint is not just important for Mrcs Part A, it's also important for Mrcs B. So if you revise it very well this time, it will come handy even for the second exam. So what you have to do, again, using the Netters anatomy flashcards, and I'm going to go through with you all the markings that you could see here in the image. If you want me to enlarge it, I can maybe enlarge it a little bit for you, so you can see it's here. Right, begin with number 1. If you can identify what this is, since it's white, you can see it has to be a capsule. This one is clavicle. This is acromion process of the scapula. And then what is this white structure? If I tell you very honestly, it's the acromioclavicular joint capsule. So it's the capsule of the joint. This is acromion, this is clavicular, acromioclavicular joint capsule, right? Now moving on to number 2. What is this? This is again in between two joints. So this is acromio and this is coracoacromion ligament. This is a ligament. So if you look at the two bones, which this ligament is connecting together or is in between, then you can remember the name of the ligament as well. Coracoacromial ligament. Okay. Number 3, moving on to number 3. So what is this number 3? A lot of structures. I told you we'll go through the structures which got insertions on the head of the humerus. This is humerus, as you could see. So this structure number 3, this is supraspinatus tendon, which has been cut from here. And you can see this is again white, so supraspinatus tendon. Number 4 is subscapularis tendon. This is again tendon, subscapularis tendon. Number 5, it's a structure, remember, it's biceps brachii tendon, the long head of biceps brachii. You can see here synovial membrane or the synovial covering the muscle tendon. Number 6, see, this is number 6, all this together. So number 6 is capsular ligament. This is all the capsular ligament which is covering the head of the humerus. Number 7, moving on, is the superior transverse scapular ligament and suprascapular notch. So this is the notch and this is the superior transverse. So because it's horizontal, so it's transverse. It's superior, so there has to be one inferior as well. So this is superior transverse scapular ligament because it's on scapula. That's how you have to remember. So this is clavicle, this is scapula. What is this number 8? Come on. Who is going to write it down and tell me? It's coracoaclavicular ligament. It's also called trapezoid ligament, or there is another third name of it. Should I tell you in this recording, or are you going to write it down in the recordings, in the video when you are watching, and then let me correct it for you, or you want me to tell you? This number 8 ligament has 3 names, okay? The third name is conoid ligament. So conoid ligament, trapezoid ligament, and coracoaclavicular ligament. All of these are the names of the same ligament. Now my question to you people are, remember the shoulder joint, it's ball and socket type of synovial joint, right? But there are certain structures, some of them I've just pointed out to you, which strengthen the shoulder joint, right? So they strengthen the shoulder joint, and shoulder joint is the ball and socket type of synovial joint, which permits all range of movements at this level. But still, I want you to think and come back and tell me what are the weakest point? What are the points where this shoulder joint is susceptible to dislocation? Right. Let me give you a hint. Dislocation, shoulder dislocation or subluxation is more common anteriorly. Why? So you have to tell me why. We'll discuss this why. And I have just told you that all type of movements, namely you can say abduction, adduction, flexion, extension, rotation, and circumduction. All these 6 movements are possible at shoulder joint, right? Moreover, if I tell you this acromioclavicular joint, this is also a synovial plane joint. And if I tell you about that permits the rotation of the scapula, right? One more thing I want you to tell me, right, if there is injury to the glenohumeral joint, usually it dislocates. I just told you that it dislocates more commonly anteriorly. Then it is called subcoracoid dislocation. At this position, I want you to think and imagine and tell me which nerves are susceptible to injury. So when we'll be revising brachial plexus, it will become more clearer to you. But now let me tell you, and you should remember it for the next time. Axillary nerve and musculocutaneous nerves of the brachial plexus are susceptible or at risk of injury when there is anterior dislocation of the shoulder joint. Good. Right, moving on. There is another view I want you to show. This is called the lateral view of the shoulder joint. Here again, let me point out there are certain structures that you should be knowing. Number 1, this is the bursa. It's called subdeltoid bursa because this is below the deltoid muscle, so it's subdeltoid bursa. Number 2 is the glenoid cavity. See? And this is the white cartilage, glenoidal cartilage that you're looking at. Number 3, if we come here, this is inferior glenohumeral ligament. So this is the inferior because it is below inferior glenohumeral ligament. If we come to number 4, this is the middle one. So middle glenohumeral ligament. Glenohumeral, gleno means glenoidal cavity, humeral means humerus, glenohumeral ligament. See? So with the attachments, you can remember it like that. Number 6. So what that is? Can anyone wait? Number 5 first. Number 5, this red structure, what that is? Can anyone tell me? It's the biceps brachii, long head of the biceps brachii muscle or tendon. Number 6, if you can guess it over here, it's coracohumeral ligament because it's coracoid process and humerus. Coracohumeral ligament. Number 7, it's acromion process and coracoid process. So it's coracoacromial ligament, right? What I want to tell you about this glenoidal cavity, that its presence deepens the glenoidal labrum and glenoidal cavity. It deepens it. And in that, because of the attachment of the capsule of the shoulder joint and the ligaments and the 4 tendons of the rotator cuff muscle, it strengthens the shoulder joint. So what are the 4 muscles which form or which are called the rotator cuff muscles? Tell me, write in the comments and tell me after watching this recording. All right, one more thing I want to tell you. Right, bursas we've already read. This is the bursa. So what's the purpose of this bursa? They basically prevent, or they reduces the frictional movement. They prevent, like, promote the frictional movement and prevents injuries. It actually serves as a function of cushions, protects the tendons and ligaments from injury, and also from frictional movements. So that's the purpose of bursies. Last thing, I want you to tell me, what is the blood supply of the shoulder joint? So shoulder joint, let me tell you, it is supplied by the suprascapular, humeral circumflex, and scapular circumflex arteries. These arteries are branches of which vessels? Write and tell me and let me know how much you how much you can revise or take from that. Right. With this, I will end today's revision. In next revision, after that, we have done the bones of the shoulder joint and the shoulder joint. We will revise the attachments of the muscles around the shoulder joint. So make sure you read that for tomorrow. Good evening. Thank you so much for today. Bye.